Chapter 1: The Long-Term Effects of Antipsychotics on the Brain. Have you ever pondered the long-term effects of antipsychotics on the brain? This question has been a subject of much scientific inquiry, and today we delve into the fascinating, yet complex world of neuropharmacology to understand these effects. Research has shown that antipsychotics can lead to significant changes in the brain, a process known as neuroadaptation. These alterations can persist long after the use of antipsychotics has ceased. A prime example of this is tardive dyskinesia, or TD, a movement disorder characterized by involuntary movements, particularly of the face. Studies reveal that it took between 2 to 5 years for 60 to 90% of TD symptoms to resolve after discontinuation of antipsychotics. And what's more, a significant proportion of patients saw a reduction in TD symptoms after stopping long-term antipsychotic treatment. Chapter 2: Withdrawal Symptoms and Relapse. But the story doesn't end there. The longer a patient is exposed to antipsychotics, the more likely they are to experience withdrawal psychosis upon discontinuation. A correlation has been observed between the duration of antipsychotic treatment and the risk of relapse on discontinuation. The risk increases with longer exposure to these drugs. So, what does all this mean for patients and their physicians? Given the long duration of antipsychotic treatment in many patients, the persistence of neuroadaptations, and evidence that withdrawal from other medications can last for months or even years, there's a compelling argument for prolonged tapering. In other words, reducing the dosage of these medications over an extended period, often months or years, could be the key to mitigating the risk of withdrawal symptoms and relapse. Chapter 3: The Importance of a Carefully Considered Approach. In conclusion, the evidence is clear. Antipsychotics can cause lasting changes in the brain, and gradual discontinuation over a prolonged period is often the best course of action to minimize the risk of withdrawal symptoms and relapse. This emphasizes the importance of a carefully considered, patient-specific approach to antipsychotic treatment, one that balances the benefits of these medications with their potential long-term effects. In the realm of mental health care, knowledge is power. By understanding the long-term effects of antipsychotics, we can better navigate the challenges and complexities of treating psychiatric disorders. And that is a step in the right direction towards improving the lives of countless individuals around the world.